Lewis, thanks very much for joining us today. And I'm going to start this with the hardest question of the lot. For someone who's never heard of Fisher Paykel Healthcare, can you give us a quick synopsis of what it is that your business does?
I think you're right, it is the hardest question of all. So we have two parts to our business, hospital and home care. Broadly speaking, our hospital products are therapies or supplemental to therapies that are used in most parts of respiratory care in a hospital. And generally they're about changing clinical practice to get a better outcome. And similar in home care, similar product portfolio and philosophy.
And a lot of the times I hear you talk about hardware and then consumables. So if we break that out again, can you give us a couple of examples of each and how they fit together?
Sure. So for almost everything we do, we will have a hardware component. So one example would be we would sell a humidifier. That's the hardware. It's electronics, it's got software, and it bolts onto a ventilator. The ventilator provides a therapy. It goes through our humidifier hardware, and then the consumable is what takes the gas flow from the ventilator and the humidifier to the patient and back. And our technology package conditions the gas to the best possible condition for the best possible outcome for that patient. And almost all the things we do will have the hardware component, and then we'll have the consumable, which in hospitals per patient, in home care and home respiratory support, it would be per month, and in OSA it's more like per year.
So in terms of that hardware and consumable split, what's it come out in the wash in terms of revenue? Like how much comes from one or the other? And
right. So before COVID, I think FY20 we were about 15% hardware, 85% consumables. But the phenomena is that as you get a bigger and bigger installed base of the hardware sales become a smaller part of the business proportionately.
And that consumables part must be reasonably reliable because there's a finite life to some of those consumables, isn't there? You can't just wash it and reuse it forever, can you?
That's correct. On the whole, it'll be one per patient because we're talking respiratory patients and we don't want the cross-contamination risk.
Yeah. And geez, COVID's been, an impact on every business and including yours. So what's some of the opportunities that have fallen out from COVID for your business?
Well, the big one is that most of our therapies can be used to treat COVID patients. So during the last 2 years, the peak COVID years, we sold about 10 historical years worth of hardware in those 2 years. So the big opportunity is to ensure that we can help hospitals and clinicians change clinical practice to use that hardware for general respiratory support and better outcomes for not COVID patients. That's the big opportunity. But then that drives another opportunity, which is that means we can invest more in salespeople to support that activity, and we can invest more in R&D to accelerate some of the more future-looking projects.
It's probably not been all one-way traffic though, has it? There must be some challenges that have arisen from COVID as well. So what's been some of the tough parts of it?
Well, during the COVID era itself, we had product ranges that accelerated to 5, 6, 7 times their pre-COVID volume, and we were doing that at speed and at velocity. And if you look at our revenue growth over the COVID years, FY21, FY22, we really weren't resourced to do that. We did that by 6,000 people working hard, working long hours. Sure. We did it the hard way. So that was certainly challenging, but kind of a satisfying challenge, I'd have to say.
And through all of that, you're starting to come out the other side. I'm not sure we can say you're quite out the other side, but is there anything that you've sort of learnt through that where you've really changed the strategy of the business, or has this just sort of cemented, you think you're doing the right things, it's just, carrying on with the same things you were doing pre-COVID?
Yeah, in terms of the commercial strategy, no real change to the business, but it's accelerated everything. We've got this base of hardware that can be utilised after COVID for not COVID patients, and so that means accelerating everything. So we're trying to pull most things we were doing forward 2 to 3 years, at least, compared to before COVID.
And when I think about your technology, it's at the cutting edge of your space. So how do you stay ahead of the competition? How much are you spending on research and development, on new products, on your facilities. Can you give us a bit of a sense of how much money actually do you throw back into the products?
Sure. So at the end of the day, what we're trying to do as a business, we're trying to have a product and a technology that offers a better outcome for patients, better than what hospitals and clinicians currently do, and better than what anyone else has. So we only do that by moving the technology, moving the clinical data. To put it into a context for you, right now we'd be about 800 people involved in R&D. Last year it was about $150 million total spend, and typically historically our R&D spend has been around about 9 to 10% of revenue.
And there's a few manufacturing facilities out there now, and you're expanding more and more into that manufacturing side offshore? Well,
the plan always was to grow the proportion of manufacturing outside New Zealand, to continue growing that. COVID set us a little bit backwards on that plan because a lot of the volume increase went into New Zealand because those 700 or 800 R&D engineers were able to help get the capacity up so quickly, and they were all in New Zealand. So we're back on track to have a greater proportion of our manufacturing output outside New Zealand going forward.
I think my data is right, or my information is right, that you've been at FPH for almost 40 years. That's a long time. Can you tell us what your first role at the company was, and maybe what's the secret sauce within the business that's kept you there for so long?
Right. So I was hired as, at the time, an electrical engineer, or electronics engineer was the title. And at the time that involved writing software and electronics design. So that was my first job at F&P. With regards to the secret sauce that keeps you there so long, I think to put it in context, you're talking about a business that doubles in size every 5 or 6 years. Yeah. When I started, we were about 40 people, towards 6,000 now, just to put a scale on doubling every 5 or 6 years. So constant change, constant opportunity, always something exciting happening in every part of the business. So I really don't see it as 40 years in the same business. It's been a different business every
year, pretty much, isn't it?
Yeah.
Look, it's been fantastic having you come in and take the time to talk to us, Lewis, so thanks very much.
All right, thank you.